This is Nina Johnson with the National Center on Early Childhood Quality Assurance, and it's my pleasure to welcome you to this webinar on resources and tools for revising and aligning early childhood program standards. Our presentation is full of links to important resources, so we'll send the slides to everyone that registered. To be respectful of your time, the webinar is only an hour. It's only an hour. So we didn't build in much time for discussion. You can certainly pose questions in the chat box, and we'll try to get to those at the end, or you're always welcome to contact us afterwards as questions come up. As a reminder of who we are, our center is one of the national centers in the Early Childhood Training and Technical Assistance System. And we're funded by the Office of Child Care, Office of Head Start, and Maternal Child Health Bureau. Here are our priorities on the slide. So you can see the very first one, advance strong health, safety, and quality standards and licensing regulations, means that we're here to help you with your licensing and your QRIS standards. And I hope that the resources that we share today will illustrate our expertise and commitment to supporting the states and territories. First, I'd like to introduce my colleague, Sherry Fisher, the Resource Development Manager.
Hello,
Hi, Sherry.
Hi.
Sherry is the Resource Development Manager at the Quality Assurance Center. Many of you know Sherry for her many years of conducting research on licensing. She's worked closely with NARA and on the licensing studies conducted every 2 to 3 years so that we can study trends over time. And she's the lead developer on most of the resources you'll see today. So today I'm going to take the role of a state licensing manager and ask Sherry for help in planning the revision of my state's requirements. And she'll respond by sharing the Quality Assurance Center resources. Of course, you can get more individualized technical assistance by contacting us. So here we go. So as you're all aware, there are many reasons that the early childhood program standards are revised. We came up, sorry, that was a lot of things at once. We came up with more than a dozen potential reasons. We wanted to focus just on 3 today. The first is incorporating new federal requirements or policy guidance. We know reauthorization has led to many states making changes to their licensing regulations, and that's why we created these resources and planned this webinar. The second is align with other program standards. As you all know, providers are participating in other programs that have their own standards. And so to encourage their participation and help streamline the early care system, it makes sense to use consistent terminology and make those standards as similar and non-contradictory as possible. And the third one we want to highlight is to reflect the type of care setting and be culturally and linguistically responsive. As the field changes and many of you will be monitoring license-exempt care for the first time, it's important to consider the setting and the demographics of the providers and families we're serving. The regulatory review process gives you an opportunity to share information with and gain input from diverse racial, ethnic, and cultural community representatives, including providers and families, and consider the language needs of those who are being reached. So Sherry, which resources, I'll say that again, which resources will be beneficial in helping to take on the process of revising regulations?
Okay. Thank you, Nina. Let's just wait. I'm going to wait a couple of seconds to see if all of this has stopped. I apologize for this. One mistake we made was not having this turned off. So I'm going to give it a couple of seconds to see if the beeping stops. And we do have a question here about in the chat box. Yes, the slides will be available, as will a recording of the webinar. Okay, I think we may have. Oh. Wait another second. Okay. Okay, I'm going to get started. So So, Nina, you asked me which resources which will be beneficial in helping to take on the process of revising regulations. So we have a great new resource for you to help you begin with your planning process. This paper, called Developing and Revising Child Care Licensing Requirements, as you see on the slide, was developed in partnership with NARA and walks you through the process and some considerations. We are in the final stages of publishing the paper, and it should be available around February 1st. And we will send a link to all of you to the paper when it is posted on our Child Care Technical Assistance website. This is the table of contents of the brief of this paper about revising regulations. It includes a section about getting started with some questions to consider. It talks about the licensing requirement review process. There's a section about formatting licensing requirements and then finalizing them. Some recommendations on how to roll out new licensing requirements, and a little bit about the use of interpretive factors. Our focus today is on the licensing requirement review process, which includes conducting research, forming a work group, and establishing review criteria. The paper provides recommendations in all these steps. For example, it provides a list of all of the types of individuals that should be considered for a work group and questions to help in establishing criteria for the review. The tools we present today were designed to support the part of the process that involves conducting research. So what those different steps could include would be an analysis of current requirements, review of the literature, comparison of licensing requirements from other states, and review of other requirements that affect child care licensing, child care programs. In addition to the paper about developing and revising licensing requirements, these other resources are available. Building Support for Licensing is a paper that provides a list of approaches that licensing agencies can use to build support from the community for their efforts. An updated version of that paper will also be available in early February, and we will send that to you all as well. The best practice for human care regulation is a set of recommendations that can be used by a licensing agency to assess its resources and processes across the board in an effort to support the regulatory program. The best practices address two major areas: organizational management and regulatory management. There is a self-assessment tool that goes along with the best practices document.
So moving to conducting research, which is our focus for today, my agency is addressing the new CCDF health and safety requirements and needs to update and add a few provider requirements to our licensing regs. Are there any national resources that could help us take a closer look at the health and safety areas in reauthorization and get some literature and research to support any changes that we make?
Yes, there are some recommended health and safety standards and a set of briefs about health and safety topics. Caring for Our Children has more than 600 guidelines and is a source for research and rationale. And we know that many state licensing requirements are based and looked at. Caring for Our Children is looked at when licensing requirements are being reviewed. Caring for Our Children Basics is a smaller set of standards that represents the minimum health and safety standards experts believe should be in place where children are cared for outside of their homes. The National Center on Early Childhood Quality Assurance is a set of briefs that can be used by licensing administrators and Child Care and Development Fund administrators as they consider revisions to state standards, licensed and license-exempt providers. This slide shows an example of one of these briefs. This link will take you to a page where they are all located. There are 9 briefs in the set, and they cover all of the CCDF health and safety topics. Each brief has these different sections, research and guidance on the topic, excerpts from Caring for Our Children Basics, links to the Caring for Our Children standards that apply to those topics, some trends from our child care licensing requirements, and examples of state licensed child care requirements and examples of state license exempt child care requirements. Those examples are actually language directly excerpted from regulations and other policies that apply to those different types of providers. And some additional resources are included. These next 2 slides list all of the topics for the brief. So we have prevention and control of infectious diseases, administering medication, prevention of and response to emergencies due to food and allergic reactions, safe sleep practices, building and physical premises safety, emergency preparedness, hazardous materials, and transportation. I wanted to mention the brief about health and safety training and say that it includes some links to some training programs that are widely used by states. Some of the national training programs like Better Kid Care and some of the APA training materials that are available widely.
Thank you. Thank you, Sherry. I think as a licensing manager, I will definitely use those. Those look really helpful. And I noticed that they do include excerpts from states' regulations, but what if I want to drill down a little bit more and have a really specific interest or topic that I want to look up in a state's regulations? Are there any tools to help me do that?
Yes, we have these 3 tools that you can do that can be used for comparing state licensing requirements and reviewing requirements. This first one, so let's start with this new website that contains all of the state's licensing regulations. It's the National Database of Child Care Licensing Regulations. It's a tool for finding and searching licensing regulations and agency contact information. And I am now going to share my screen and actually go to the tool itself and show a little demonstration of how it works. So you should all be seeing a screen that shows the database. And what I'm going to show you is that, first of all, it has a section here with some national resources where if I click on that, it provides links, direct links to some of the national papers and policy statements. For example, here are direct links to the Child Care and Development Fund requirements, to the Head Start program standards, kind of anything about early childhood program standards. This website is kind of a one-stop shopping for anything related to program requirements. So if I go back to the home page, as you can see, there's a map. There's a map in which you can connect to different states. All of them are highlighted, and you click on the state, or you can use a drop-down box from up here. I'm going to pull up one state, and I'm going to choose the state of Kansas. And this is what you'll see on the screen. Every state has a profile similar to this. There is the licensing agency contact information with the address and phone number, the agency website, and also a link to the child care search page. And we've made sure that this search engine is the one in which the states who do post their licensing inspection reports for each child care provider, that this is the website to go to look at those, to search for child care and look at those inspection reports. So in the middle here is links to a list of and links to all of the licensing regulations for the state that relate to child care. And also, for some of the states, we've also collected some of the statutes. So here we have, for Kansas, their child care licensing laws, and that's their statute that pertains to child care licensing. So I'm going to click on the licensing regulations for centers, and you'll see that what this page brings up is the date of the document, whether it's a regulation or a statute, the facility type, provider type that it covers, and a direct link to those regulations on the state's website. But the other thing that's included is a downloadable and printable PDF document of the regulations itself. And I'm going to show you in a moment how that can be used. I'm going to go back to the front. The other thing that you could do is see if you wanted to see, for example, which states have newer regulations in place. The database website has an advanced search feature, and this is the piece that we're really excited about. As you can see, there is filtering that can be done by the document type, whether it's a regulation or a statute, the facility type, by state, and by the year. And these little numbers next to them just show how many documents there are for each filter, each variable. So I'm going to show, for example, I'm going to look at regulations, and I think I'll look at child care center regulations. And we want to know which states have regulations from 2016, and there are 21. So next, the list down here will show you in alphabetical order by state all of the regulations, all the state regulations that were updated in 2016. Only, I think there's 10 that show on a page, so you have to go down to the bottom to scroll through and get to all of the results. But that's basically how that works. So you may want to look at regulations on a particular topic. Nina, is there a topic you'd want me to look at?
Yeah, and I just have to say, that's very cool. I'm excited about that.
Yeah.
How about responding to children's food allergies? Because this is an area where my state doesn't have any requirements.
Okay. So I'm going to do a keyword search. I reset the filtering, and I'm going to go into the search box and type in food allergies and hit apply. And as you can see, it shows that there are 42 regulations where the phrase food allergy appears, and they are listed in alphabetical order by the state. So I think I want to narrow that down and just look at one state. I'm going to look at Delaware, just as an example. They have, it showed that there were 3 documents that address food allergies, and I'm going to look at their child care, early care and education, and school-age center regulations. And this is where the PDF document comes into play. I'm going to click on that, and there's a search feature that's attached to the PDF, and type in food allergies here, search, and it'll show you here on the side and within the document all the places where food allergies appear in the regulation.
That's great.
Yeah. So I'm going to now close out my screen share and go back to the PowerPoint. And talk about our reports on trends. Trends in licensing regulations and policies that were done in 2014. We work collaboratively with NARA to do periodic licensing studies, and the last one that we did was in 2014. And they include a compilation of requirements from regulations and an analysis of a survey that NARA sends out to all of the licensing agencies across the country. I'm sure some of you on this call have filled out that survey. And what we've done is published a set of research briefs, one by each type of facility, that includes a look at how many states have requirements in certain areas. The topics covered include supervision of children, ratios and group size, health requirements, staff qualifications and training, and many, many licensing policies like frequency of inspections, qualifications for licensing staff, and enforcement tools.
So Sherry, I have a question.
Okay.
Where have you seen the most change over the years?
In terms of the most change, after many years of doing these studies, I'd say that the requirement with the most changes has been in safe sleep. We started tracking that in 2005, and 24 states required centers to place infants on their backs to sleep at that time. So that was about half the country. Now, in 2014, we found that number was 47 states. And that has consistently been the requirement that has increased over the different years that we've done a study. We will be conducting the next study later in 2017. The 2014 study was done before CCDF reauthorization was passed and has provided a really good baseline of where states are at that time. The 2017 study will allow us to see changes states have made to requirements in response to reauthorization and all of the new health and safety requirements and monitoring requirements that now exist. So it'll be exciting to do that comparison. We have another tool called Data Explorer that includes some 50 state level data from the 2014 trends. And I'm going to share my screen again and show you how that tool works.
So Sherry, as you're pulling that up, I'm thinking I have one specific question I'd like you to look up on here if you can.
Okay.
One of the requirements in my state, one of the requirements my state needs to add is group size in child care centers. So can you use this tool to show me the group size requirements for all of the states?
Yes, absolutely. Group size is one of the sets of data that we do have in the tool. So this is our Data Explorer. It is a tool that has some licensing data in it, but also has lots of other data around early childhood. So I invite everyone to come and take a look at it. But I'm going to focus on what we have on licensing in particular. So I want to look at all of the states, so I can select all. There's also the option of just selecting one or two states. You can select states that are in your region or neighboring states. But I'm going to select them all. And I'm going to choose health and safety. That's our topic. Our subtopic is licensing. And then the definer is the data that we have. So as you can see, we have several different variables in here, and one of them is the group size in child care centers. I'll scroll down a little bit, and you can see we have things on background checks, pre-service qualifications, training requirements, and also the types and frequency of visits that are done in centers and family child care and group child care homes. But I'm going to show you the data that we have on group size. And I'm going to hit search and scroll down, and you will see the results. This shows for several different age groups, the major age groups and the specific age that they represent, and what the group size requirements are for those specific ages. And again, note that this is data that was collected in 2014, so we know that there were probably changes that have been made, but this is what we learned from that study. And I'll just scroll down and you'll see all of the states are included.
That is very helpful. Thank you.
You're welcome.
And I also want to see how my state's requirements compare to other national standards. So I'm wondering, what do some of the national standards say about food allergies?
Okay. Let's go back to the PowerPoint for a moment. And so to do that, we have a couple of tools. We have the National Program Standards Crosswalk tool, and we have a newer tool called the Caring for Our Children Basics Health and Safety Standards Alignment Tool. And I'm going to show you both of those next. I'm going to go back to sharing my screen and pull up the crosswalk tool. This tool has been around for a couple years, so I hope folks have had a chance to check it out. If you haven't, I'll show you just a little bit about how it works. This is the login screen. It requires that for use that you register for an account, but it's just a simple email and password that you set up. And there's instructions that can be gotten from here. But I'm going to go ahead and do a search since you asked to log in. So you wanted to know about food allergies. So the way the crosswalk tool is set up is that there are these 10 high-level topic areas, and nutrition is one of them. And within those 10 topic areas are several subtopics. I'm going to open up health and safety, for example, and show you all the many different subtopics that we have in here. But we're going to focus on food allergies. So under nutrition, we have we already have a subtopic about allergies. So I'm going to select the topics and then click on this button. Now, one thing that this tool has that I think really makes it very helpful is this is the list here of all of the different sets of standards that are in the crosswalk tool. You will notice that we have just recently added the CCDF final rule language in here. We pulled out some of the specific requirements that are for providers. Really, the purpose of this tool is to look at the content of standards, the standards that apply to providers. It's not meant to be a way of determining whether or not like a provider is in compliance with the standards. It really is a way for states who are working on licensing or quality rating and improvement system standards to see, like Nina, as you asked, to see what other sets of standards have to say on the topic. So we have in here the different versions of Caring for Our Children. We have the full set, plus we've marked the ones that are in the stepping stones to Caring for Our Children, which is a kind of a subset of the large set of standards. We have Caring for Our Children Basics, and we have several national accrediting bodies as well, including NAEYC and the National Association for Family Child Care. We even have the Department of Defense standards in here. Now, one thing you may notice is missing is the Head Start performance standards. We are in the process right now of doing the crosswalk of the new Head Start standards and expect that within the next couple of months, those standards will appear in the tool. But we were able to get the CCDF final rule added before this call. So as I was saying, one of the really great features is that this little table will pop up, and it will show you for all of the different sets of standards how many criteria there are within each individual set. So for example, here, the Association for Christian Schools International, their early childhood accreditation does not include any standards that address food allergies. But Caring for Our Children has 4. NAYC has 2. CCDF has 2. So I'm going to choose those 3 and show you what the results look like. Anyway. Actually, I'm going to choose Caring for Our Children Basics, not the full Caring for Our Children. And this is the screen that you'll get. It is basically, we have directly excerpted the language from those standards documents, and it appears on the screen like this. We've set it up so there's only there's a limit of only 3 sets of standards that can be chosen at a time. Basically, because that's all that could fit nicely on the screen, and so that you'd be able to read what's there. But as you can see, it shows what the different sets of standards are, and they're placed in here in order by like in a numerical order. So here's for NAYC, you can see that there's a numerical order of, well, I should have looked at that first, but they're in opposite order for here, but it's really based on what the number is and how they get pulled up. Another feature is that you can you can get a nice printout of the standards results, and also there is a download to an Excel spreadsheet. I'll open that up, that you can save and work from as you're using this tool. So what this does is it puts into an Excel spreadsheet the 3 sets of standards that are available from your search. One thing to note is that these columns that have the national standards in them are kind of locked into place. You cannot edit them, you cannot type in them, and that was at the request of some of the accrediting agencies who were concerned about copyright issues and the standards being manipulated in any way. But what you can do is type into these 2 columns, the one that says state licensing requirements and the one that says QRIS standards. Those you can type into, and you can use this Excel spreadsheet to help with a comparison that you may be doing with your own standards. I'm going to close out of that. And then I think we'll move on to the other tool that we have. And I'm going to go back to the PowerPoint. So the next tool we have is our Caring for Our Children Basics Health and Safety Standards Alignment Tool. And this is the website link to take you to that tool. I'm not going to pull it up today because it's basically a document and that you can review, you can see on your own. But I did pull out some examples from it. There are several users for this alignment tool. And what it does is it provides a simple format for states and territories to compare their current early childhood program requirements and standards against the recommended health and safety standards in Caring for Our Children Basics. The document is a fillable PDF document that could be downloaded and saved and used to fill in with the work that you do. So as I was saying, there are several users for the alignment tool and reasons to use it. You can, if you're doing a professional development with staff, it could be used for reviewing some training content. As you know, we're talking about today, licensing staff and policy developers can use this when drafting new standards or best practice guidelines and training new staff. It can be used with developing standards for QRIS. It can be used in training and technical assistance, or it can be used, also for planning. So just to give you a sense of how it works, in the tool, all of the Caring for Our Children's basic standards, which there are about 66 of those, the language of them is included in the tool. And for example, this is the one that's about first aid and CPR training for staff. In this tool, you can type in state licensing or QRIS standards that relate to the CCDF, the Caring for Our Children Basic Standards. The notes section here can be used to document gaps in state standards or ways state standards exceed the Caring for Our Children Basic Standards. This example here shows how the state documents their licensing regulations are fully aligned with Caring for Our Children Basics. The concept of the assessment is whether or not there's full alignment, partial alignment, or no alignment. This example here shows a example of full alignment. So the state standard reads, all caregivers must with direct care responsibilities must have current certification in pediatric CPR and documentation of current training in pediatric first aid. And training records must be on file at the operation and available for review upon request. So it shows here in the notes that these elements are found in both Caring for Our Children Basics and in the state standards, which that it applies to all persons who provide direct care and requires pediatric first aid and pediatric CPR, and that the training must be current and documentation must be at the facility. So that you shows what the alignment is between those two sets of standards. The document, if you go and look at it on the website, also includes an example of one of which there is partial alignment with the standards. So you can check that out when you check out the tool.
And Sherry, this is Nina. I just wanted to point out too, just to provide a little context, that the preamble to the final rule recommends that lead agencies looking for guidance on establishing health and safety standards consult Caring for Our Children Basics. And it says lead agencies can be confident that if their standards are aligned with basics, they'll be considered to have adequate minimum standards. Of course, they're encouraged to go beyond these baseline standards. But, I think that just helps provide some context as to the importance of aligning with Caring for Our Children Basics.
Yes, definitely. So that's the last of the tools that we're going to demonstrate today. This slide here provides the websites that you could visit. All of the tools that I've mentioned are located here, and also in the slides have the direct links. But we have the Child Care Training and Technical Assistance website, which includes our Early Childhood Quality Assurance Center, but also all of the other centers in the child care TA system have pages on there. This is the page to our Quality Assurance Center website. And then, of course, if you have questions about resources or technical assistance, you can contact either Nina or I to ask additional questions.
Thank you, Sherry. That is incredibly helpful, both as a licensing manager and a TA provider.
Yes.
There are a couple of questions that came in the chat box, and I see there may be some more coming in now as well. One of them was about the Caring for Our Children Basics Alignment tool that you just went over. I think this one was from Tammy. She asked if this could serve as a self-monitoring tool. And Tammy, if you want to elaborate on that, feel free to type into the chat box. But does that kind of make sense to you, Sherry?
Yeah, it probably could. I mean, we do have a little bit of time, so why don't I open up that document. And since we do have a little extra time, I will open it up and share my screen. Oops, sorry. While I'm getting that posted, please feel free to add more to the chat box.
And also, while you're bringing that up, caring for, I'm sorry, I just spaced out while I was talking, child care or best practices for regulatory administration, which we worked on with NARA, also would be, if you all are not aware of it, that's a really great self-assessment tool. So when you're thinking about assessing your own licensing agency, that's a great tool to use too in terms of self-monitoring.
Okay. So I'm assuming that the alignment tool is showing on our screen, right?
Yep, I see it.
Good. So I'm going to just scroll down. We have, here is listed all of the different standards that are included in Caring for Our Children Basics. And this is the instructions. And here is the example I shared earlier about full alignment. And this is also the example around using it for partial alignment. And then there's also one here, an example of no alignment that you could take a look at. But I'm just going to scroll down and show you how it's set up. So every standard isn't listed in there. Here is the ratios for centers and family child care homes. And then there is this assessment tool. So it can be used in any way that you see fit. It's more of a internal planning document, but I hope there's many different uses for it.
And then I think we have a couple other questions in the chat box.
Okay.
When you pull it back up. I'm actually not able to see them anymore for some reason, so there they are. One of the questions says, the update only shows individual regulations that have been updated, not the entire set of regulations. And so I assume that's referring to the regulation database. Can you respond to that?
Sure. It is the full. It's the date of the full set of regulations. That's what the date reflects. What we'll do, what we do is, as I use that tool quite a bit, and as I'm using it, if there are updates that I find to the regulations, if the dates have changed, I can pretty quickly make that change and include the new set of standards. But twice a year, probably I'd like to start this in February, we're going to do a full link check and review to see if any states have made any other changes to their regulations, and then make that change in the database. But it does reflect the date of the whole document. It's really difficult to show what specific changes have been made in a set of regulations, but that's kind of what our licensing studies do. While we do it on every couple of years, we are able to track what the changes are and what the trends are in terms of where states are making updates to their requirements.
So, you said they're updated twice annually?
Yes. This is, the tool has just been launched, so we haven't done a big update yet. The tool, but we will be starting to do that.
And so if a state wanted to make sure that the most recent regulations were up there, would that be helpful for them to contact our center?
Yes, of course.
Okay, okay.
Yes.
So they can contact, one of the questions in the chat box was who they need to contact to update the information in the regulation database. And so our center contact information is on the slide deck, and Sherry's individual email is on there as well. Sherry's the go-to person. And then there's another question, while you're finding our contact info, there's another question. Does the national database include standards other than licensing.
Yes, yes, and I failed to mention that. Yes, we also include in the database direct links to 3 other sets of state standards. One is their QRIS standards. Another is the any standards that have been established for pre-K programs, for preschool programs, or publicly funded preschool programs. And the other is sets of standards that apply for the Child Care and Development Fund program. There are, states do have separate sets of standards that apply to those. For right now, the database only has just direct links to those standards for the states. I think one thing that we may explore as an enhancement is to include those as well in the search function, but that's something for down the road for us to explore.
Well, it's always nice to know that there's room for improvement, I think.
Oh, yeah.
Yeah, it's great, but there's so much potential.
Yeah.
We do have a question about the slides being available. I think that, will they be emailed out to everyone who registered, and then will they also be available on the website?
Yes, they will, as
Okay.
well as the recording.
That's great. And then we have one final comment. As a former state licensing administrator, I'm amazed at the resources currently available to licensors as they update their regulations. I'm envious. Well, that's great to hear, but I'm so sorry that they couldn't benefit you before. She said, I wish I had this resource at that time. Thanks for sharing this info in a single source. So that's great feedback. Thank you very much. So as you create new requirements or revise existing ones, we hope you'll use these tools and resources. Our center can demonstrate tools and help you with research and facilitate peer-to-peers too. And before you leave, we're going to ask you to respond to 3 polling questions. So if you can hang tight for just a couple more minutes, we're pulling those up on the screen. As you're filling those out, we just want you to know how much we appreciate you taking the time to participate. And we hope you all have a really nice afternoon and evening. Thank you.
Thank you.